What I'm about to share with you may completely change the way you think about blood sugar and what it actually means for your health after 60. Because if you are over 60, the most dangerous blood sugar pattern is probably not the one you've been warned about. And when I explain the number that quietly puts thousands of seniors on a path toward nerve damage, kidney failure, vision loss, and heart disease, you're going to understand why so many older adults feel completely safe with readings that are actually warning signs. This is one of the most misunderstood topics in all of senior health, and misunderstanding it can cost you years you thought you still had. Right now, somewhere a senior is looking at a fasting blood sugar of 118 and feeling relieved because their doctor said it's just a little high. Somewhere else, another senior is seeing a reading of 94 and feeling proud, completely unaware of what's happening inside their body after meals. And in both cases, danger may already be building. That's the part almost no one explains clearly. Blood sugar is not just about one fasting number. It's about what happens after you eat. It's about what age does to insulin sensitivity. And it's about a pattern in those numbers that tells the real story of your risk, one that most seniors never get to hear. I'm Dr. Rachel Norwood, and before we go one step further, subscribe now, because by the end of this video, you are going to know 3 things with absolute clarity. First, which blood sugar reading becomes most dangerous after age 60 and why? Second, which blood sugar pattern puts too many seniors into a false sense of security, even when their fasting number looks acceptable? And third, which reading means you should stop everything and seek medical attention right away? I need you to stay with me, because the answer is not as simple as high is bad and low is fine. In seniors, the danger changes shape, and that's exactly why so many people miss it. Let me start with Margaret, because her story shows exactly how this confusion becomes dangerous in real life. Margaret was 73, careful, health-conscious, and proud of the fact that she had never been diagnosed with diabetes. Every year at her physical, her fasting blood sugar came back around 104 to 112. Her doctor said it was slightly elevated, but nothing alarming. She felt mostly fine, a little tired in the afternoons, sometimes foggy in the mornings, but nothing that felt serious. She assumed she was doing well. Then one evening, after a normal dinner of rice, bread, and a small bowl of fruit, Margaret felt her vision go blurry. Her hands tingled. Her heart raced. She sat down, took a sip of water, and waited for it to pass. What she had experienced was a blood sugar spike, a rapid rise after meals that her fasting number had never revealed. And those spikes had been happening quietly for years, damaging her blood vessels, straining her kidneys, and silently stressing her heart every single time she ate. Margaret did not have safe blood sugar. She had one of the most common and dangerous patterns seen in older adults. And she had mistaken it for something mild simply because no one had explained what mattered most. To understand why this happens, you need to understand what blood sugar numbers actually mean. Your fasting blood sugar is the glucose level in your blood after you have not eaten for at least 8 hours. It tells you the baseline. It tells you how well your body manages sugar when it has nothing new to process. Your post-meal blood sugar, also called postprandial glucose, is the level 1 to 2 hours after eating. This number tells you how your body responds to an actual sugar load. And for millions of seniors, this number is far more revealing than the fasting number alone. Both matter. Both can become dangerous. But after age 60, the post-meal response often begins telling a much more important story about long-term risk than most people realize. And that shift happens because the body you had at 40 is not the body processing blood sugar at 65, 70, or 80. When you are younger, your cells respond to insulin efficiently. Insulin is the hormone that tells your cells to absorb glucose from your blood. Your body makes it, your cells use it, and blood sugar returns to normal relatively quickly after eating. But as you age, that process slows down. Cells become less sensitive to insulin, a condition called insulin resistance. The pancreas may still produce insulin, but the cells don't respond as well. And so blood sugar stays elevated longer after meals. Peaks go higher, recovery takes longer. This is why a senior can have a fasting blood sugar of 105, which sounds nearly acceptable, while their blood sugar after lunch is spiking to 190 or 210. The fasting number doesn't show that, but the damage from those repeated spikes is very real. And that is the pattern most seniors never know to look for. Now here's the part that can save your life. If you are over 60 and wondering which blood sugar measurement most often reveals dangerous risk, the answer is usually not just the fasting number. It is the post-meal reading, the pattern of spikes, and the trend over time. Because in older adults, those post-meal surges are often the strongest early signal of vascular damage, nerve stress, kidney strain, and cardiovascular risk. This is why a fasting blood sugar of 110 can mislead a senior into thinking everything is under control, while hours after every meal, the real damage continues. Let me tell you about Gerald, 71, because his story shows exactly how deceptive this can be. Gerald was a retired accountant, organized and disciplined, who monitored his health closely. Every morning before breakfast, he checked his blood sugar. His readings looked like this: 108, 112, 106. His doctor had told him he was in the pre-diabetic range and to watch his diet. Gerald thought he was watching. But what Gerald never checked, and what nobody told him to check, was what happened after meals. Had he checked, he would have seen 178 after his morning toast and orange juice, 204 after Sunday pasta, 165 after what he thought was a healthy lunch. His arteries were absorbing the damage from those spikes every single day, while he congratulated himself on his stable fasting readings. By the time Gerald started noticing tingling in his feet and unusual fatigue in his legs, the process had already been underway for years. This is why relying on fasting blood sugar alone is so dangerous in seniors. It is incomplete, it is quiet, and it looks less alarming than it really is. Seniors see a fasting number under 115 and assume the situation is acceptable. But what that number is not telling you is how high your blood sugar climbs after meals and how long it stays elevated before coming back down. That repeated exposure is where the nerve damage, the kidney stress, and the cardiovascular risk actually build. The danger is not always loud. It doesn't announce itself with dramatic symptoms. It slowly erodes the small blood vessels and nerves that your body depends on, until one day the consequences are impossible to reverse. And yet, I need to slow you down for a second, because if I stopped here, the message would still be incomplete. Post-meal spikes are usually the most important long-term danger signal after 60. Yes, but the single most immediately dangerous blood sugar situation is not a high post-meal reading. It is a severely elevated reading, usually above 300, especially when it comes with warning symptoms. Or the opposite extreme, blood sugar that drops dangerously low, especially in seniors on diabetes medication. That is where this stops being a conversation about long-term risk and becomes a conversation about danger right now. Let me tell you about Evelyn. Evelyn was 77 and had been on a diabetes medication for 2 years. One morning, she woke up feeling shaky and cold. Her vision was strange. She walked to her kitchen, felt her legs weaken, and had to sit on the floor to avoid falling. She tested her blood sugar. It read 48. She had no juice, no glucose tablets, nothing she'd been told to keep nearby. Her grandson found her on the kitchen floor 20 minutes later, confused, pale, and unable to explain what had happened. Hypoglycemia, low blood sugar, is one of the most underestimated emergencies in seniors. And it is more dangerous in older adults than in younger ones because aging slows the body's ability to recognize the warning signs. Younger people feel sweaty, shaky, panicked. Older adults may simply feel confused, weak, or just wrong. And by the time someone around them notices, a dangerous amount of time may have already passed. So I need to say this clearly. If a senior on diabetes medication becomes suddenly confused, weak, pale, unsteady, or unresponsive, and especially if they haven't eaten recently, that is not a wait-and-see situation. That is emergency territory. That is when you give sugar immediately and seek medical help. Too many seniors and their families treat these episodes like passing moments of fatigue, but blood sugar at dangerous lows can cause falls, loss of consciousness, seizures, and brain injury. It deserves immediate action, not observation. Now here is the twist that catches so many older adults off guard. A mildly elevated fasting blood sugar can absolutely be dangerous over time. But outside of that acute emergency, the reading seniors most often misread is not the fasting number at all. It's the post-meal number. And it's the gradual widening of blood sugar swings, the difference between the low point and the high point throughout the day. Doctors call this glycemic variability. And research increasingly suggests that in older adults, high variability, big swings up and down, may be just as damaging as a consistently high number. Because every sharp rise stresses the blood vessel walls, every sharp drop stresses the heart and brain. And most seniors monitoring only their morning fasting number never see those swings at all. Let me show you how this plays out with Franklin, 79. Franklin had been carefully managing his blood sugar for years. His log was immaculate. Fasting readings every morning, 116, 118, 114. His quarterly blood test, the A1C, consistently came back around 6.8. His doctor told him he was doing reasonably well for his age. But Franklin had started waking up with headaches. He had nights where he slept heavily but woke exhausted. He felt fine after breakfast, but strangely anxious and restless by mid-afternoon. What Franklin did not know was that his blood sugar was swinging significantly throughout the day, rising sharply after meals, dropping lower than ideal in the early morning hours. His body was working hard to compensate for those swings, and the effort was wearing it down. The A1C test, which measures average blood sugar over 3 months, was masking the problem. Because averages don't show peaks, averages don't show valleys. Averages show the middle of a story that might have dangerous extremes on either end. This is why a senior can have a seemingly acceptable A1C and still be experiencing blood sugar patterns that are quietly damaging the brain, kidneys, and cardiovascular system. And yet, and this is where seniors get pulled into a completely different kind of danger, sometimes the most damaging thing is not a high number at all. Sometimes it is the treatment itself being too aggressive. Because after 60, especially if you are taking blood sugar medication, it is possible to lower glucose so far that the body cannot function safely. And the consequences of that can happen faster and be more dangerous than the high blood sugar itself. Let me tell you about Clarence, 76. Clarence had worked hard to control his diabetes. He changed his diet dramatically, started exercising daily, and took his medications exactly as prescribed. His blood sugar dropped significantly, and his doctor was pleased. But Clarence started feeling unsteady walking to the mailbox. He began skipping his afternoon walks because he felt weak halfway down the street. His wife noticed he seemed slower to respond in conversation. His blood sugar readings had been dropping into the low 70s, and sometimes the 60s before meals. What no one had explained to Clarence was that in older adults, aggressive blood sugar lowering can create a new set of risks. The brain in a senior has often adapted to slightly higher glucose levels. Drop that level too quickly, and the brain may not adapt as smoothly. The kidneys and heart may also be affected. Falls become more likely. Cognitive sharpness can decline. That doesn't mean a senior should accept uncontrolled blood sugar. It means context matters. And in seniors, a blood sugar that is dropping too low, especially with symptoms like dizziness, confusion, or weakness, deserves careful evaluation, not just celebration. This is where the blood sugar conversation becomes more honest, because the internet loves simple answers. It wants one villain. It wants someone to say high blood sugar is always the problem, or medication is always the solution. But real life in older adults is not that simple. After 60, the post-meal pattern is usually the most important long-term signal. A severely high or dangerously low reading is the most immediately dangerous emergency, and a treatment plan that drives blood sugar too low in a senior becomes a different kind of trap entirely. So if you were asking me, doctor to patient, which blood sugar pattern is most dangerous for seniors over 60, here is the honest answer. The most commonly dangerous pattern is post-meal spiking. Blood sugar rising sharply after meals, even when fasting numbers look acceptable. The most immediately dangerous pattern is either extreme, blood sugar above 300 with symptoms, or blood sugar below 70 in someone on medication, especially with confusion or weakness. And the most deceptive pattern may be a fasting number that looks borderline acceptable while post-meal spikes go unmonitored for months or years. That combination can fool seniors into thinking the situation is managed when the real damage is building silently every single day. Now let me make this practical, because this is where you start protecting yourself. If your fasting blood sugar is in the hundreds and your doctor has said to watch it, don't just watch the fasting number. Ask about testing after meals. Ask about your A1C. Ask whether your post-meal readings have ever been measured. That is where so many seniors are surprised. If you are on blood sugar medication and you feel dizzy, weak, confused, or unsteady, especially before meals or after skipping a meal, take that seriously. Do not assume it's just tiredness. That is how dangerous lows are missed in older adults. And if your blood sugar readings have been changing, fasting numbers slowly creeping higher, energy dropping, thirst increasing, vision blurring, bring that pattern to your doctor. Not one isolated reading, the pattern over days and weeks. Because your body is telling you something, and that message deserves attention. Let me tell you about Patricia, because her story ties this all together. Patricia was 71 and terrified of diabetes because her father had lost a foot to diabetic complications at 74. She monitored her fasting blood sugar every morning without fail. For nearly a year, her readings hovered between 110 and 120. She went to her appointments. She watched her sugar intake. But what Patricia never measured was her post-meal blood sugar. And what she never told her doctor was that she felt exhausted every afternoon, that she was waking up at 3 a.m. with a racing heart, and that her vision had become slightly fuzzy in the evenings. When she finally described those symptoms clearly, and her doctor ordered a more complete glucose evaluation, the picture was different from what the morning numbers suggested. Post-meal readings were regularly above 180. Her variability was significant, and her nighttime blood sugar was dropping in a way that was disrupting her sleep and stressing her cardiovascular system. The fasting number had told one story. Her body had been telling another. And it took the full picture, the pattern, the symptoms, the timing, to understand what was really happening. And that word, pattern, is everything here. Good blood sugar management in seniors is not about chasing one number. It is about understanding how glucose moves through your body throughout the day, how it rises after meals, how it responds to stress, how it behaves overnight, and how your body feels during all of it. It is about protecting the blood vessels without starving the brain, protecting the kidneys without making you too unsteady to walk safely. That's why blood sugar management after 60 requires more nuance than younger adults often need. The goal is not just lower, the goal is safer. And safer depends on pattern, symptoms, consistency, and how your body is responding to your current approach over time. There is another reason post-meal blood sugar becomes so important after 60, and it has to do with the heart. Research has shown that the sharp rise and fall of blood sugar after meals places significant stress on the cardiovascular system. The blood vessel walls become inflamed, the heart works harder, clotting risk rises temporarily, and in a senior whose arteries may already have some stiffness or narrowing, those repeated post-meal stresses accumulate. This is one reason blood sugar problems are so often called a silent disease. They do damage quietly, day after day, without always producing symptoms you can feel. By the time numbness, vision problems, or kidney changes appear, the process may have been underway for years. That's why repeated post-meal elevation deserves respect, even when you feel normal, especially when you feel normal. And let's talk about feeling normal, because this is where seniors lose precious time. You cannot rely on symptoms alone to tell you whether your blood sugar is dangerous. Plenty of seniors walk around with post-meal readings regularly over 160 and feel completely ordinary. No dizziness, no blurry vision, no dramatic signal. The body adapts just enough to keep the danger hidden. That is why a calm afternoon does not mean a safe blood sugar. It is not judged by how dramatic it feels. It is judged by what it is doing to your blood vessels, nerves, kidneys, and brain over time. Now I want to address one of the most common things I hear from seniors. A patient will say, "My fasting blood sugar is a little high, but my A1C is okay. So don't they sort of balance each other out?" No, they do not balance each other out. A high fasting pattern can indicate chronic insulin resistance, even when the A1C is only borderline. And a borderline A1C can mask significant post-meal spikes that the average doesn't capture. One reading does not erase the concern of another. In seniors, the relationship between all of these numbers is often the whole story. So what should you actually watch for at home? Watch for patterns. If your fasting blood sugar is repeatedly above 110, take that seriously. If you feel significantly worse in the afternoon or before dinner compared to the morning, that is a clue about what your blood sugar may be doing. If you feel shaky, weak, or confused before meals or after skipping one, take that seriously too. And if a very high reading comes with unusual thirst, frequent urination, confusion, or extreme fatigue, act immediately. One random high reading after a holiday meal may not tell the whole story, but a pattern repeated across weeks and months is your body sending a clear message, and that message deserves to reach your doctor in full. This is why no senior should adjust their medication on their own based on one reading, but it is also why no senior should dismiss a creeping pattern of elevated blood sugar simply because the fasting number sounds like it's only a little high. Both mistakes are common. Both can cause serious harm. Blood sugar management after 60 is a balancing act that deserves individualized care, not guesswork. And the more your pattern includes high post-meal readings, significant swings throughout the day, low episodes before meals, or new symptoms, the more important it becomes to bring that full picture to your doctor, rather than chasing one number by yourself. Now, if you're wondering which blood sugar measurement doctors historically focused on most, it used to be fasting glucose almost exclusively. For decades, that was the number on the lab report, the number at the annual physical, the number used to diagnose or rule out diabetes. And it is still important, but the science has shifted because the physiology shifts with age. Post-meal spikes, glycemic variability, and the full daily pattern of glucose movement are now understood to be critically important, especially in older adults. That is why so many seniors are still following an outdated mental framework for a body that is now managing blood sugar very differently than it did 20 or 30 years ago. Here is the simplest way I can say it. After age 60, your post-meal readings often become the louder warning about long-term damage. Your fasting number becomes critically important when it is very high, trending upward, or paired with symptoms you can feel. And the swings throughout the day matter because they reveal how much stress your blood vessels and heart are absorbing every single time you eat. That means the most dangerous blood sugar pattern is not always one number in isolation. It is often a trend. And the seniors who stay safest are the ones who stop asking which number can I ignore and start asking what pattern is this revealing. Let's make that pattern unforgettable. If the post-meal blood sugar is persistently above 180, that is dangerous over time. If blood sugar is above 300 with symptoms of thirst, confusion, or extreme fatigue, that is dangerous right now. If blood sugar drops below 70 and you feel weak, shaky, confused, or pale, that is dangerous in a different and immediate way. And if your readings are showing wide swings throughout the day while your fasting number looks borderline acceptable, that is a clue you should not dismiss. Once you understand these four realities, blood sugar stops looking like one morning number on a piece of paper and starts looking like a real clinical picture. The kind of picture that can help you act before a crisis happens. Now, I also need to warn you about one of the most dangerous emotions in medicine: false reassurance. Panic can send you to the doctor, and sometimes that saves you. But false reassurance keeps you sitting still while damage continues. A senior sees a fasting reading of 112 and says, "Well, it's not technically diabetic range, so I'm probably okay." A senior sees an A1C of 6.7 and says, "Well, it's only a little above normal." That quiet inner voice is exactly where bad outcomes begin. Because blood sugar danger in older adults often hides inside readings that look only slightly off and feel completely ordinary. Let me tell you about Dorothy. Dorothy was 68 and had been told at 65 that she was pre-diabetic. She made some changes, reduced desserts, walked a few times a week, and at her next appointment, her fasting blood sugar had come down slightly. Her doctor said to keep doing what she was doing. Dorothy felt reassured. For the next 3 years, she monitored only her fasting readings and continued to keep them in the 108 to 116 range. She told herself she had the situation under control. What she had not controlled was what happened after her meals. What she had not addressed was the post-meal pattern that had been quietly elevating for years. By the time nerve tingling in her feet and persistent fatigue brought her back to a thorough evaluation, the blood sugar picture was far more serious than her fasting numbers had ever suggested. Was it caused by one reading? No. It was caused by a pattern that had been misunderstood for years. And that is exactly why the most dangerous blood sugar for seniors is often the one that looks familiar enough to ignore. So what do I want you to remember when this video ends? I want you to remember that for seniors over 60, post-meal blood sugar patterns often carry more danger than most people think. I want you to remember that extremely high or extremely low readings with symptoms are medical emergencies. I want you to remember that a blood sugar that drops too low, especially in someone on medication, can cause falls, confusion, and real cardiac risk. And I want you to remember that glycemic variability, wide swings throughout the day, is not just math. It is often a sign that the body is under pressure it is not equipped to handle safely anymore. If you've made it this far, you already understand more about senior blood sugar management than most people who check their glucose every day. And if this is helping you see your own readings differently, subscribe to the channel and share this video with someone over 60 who still thinks the fasting number is the only one that matters. This information can prevent panic, but more importantly, it can prevent neglect. It can stop someone from dismissing a dangerous post-meal pattern, and it can stop someone else from celebrating a fasting number that is hiding a much more complicated story. Before we finish, I want to give you the answer one last time, plainly, so there is no confusion. The most dangerous blood sugar pattern for seniors over 60 is usually a persistently high post-meal glucose, because that is the pattern most strongly tied to silent long-term damage in older adults. The most immediately dangerous reading is either a very high blood sugar, above 300, with symptoms, or a very low blood sugar, below 70, with confusion, weakness, or loss of consciousness. And the most deceptive pattern is a borderline fasting number paired with unmonitored post-meal spikes, because it looks acceptable on the surface, while the real risk continues building underneath. If you understand those three truths, you will never look at a blood sugar reading the same way again. Your glucose monitor is not just giving you a number. It is giving you a window into how your metabolism is aging. It is showing you whether your body is processing meals safely, whether your blood vessels are absorbing stress they cannot afford, and whether your current approach is protecting you or leaving you exposed. But only if you know how to read what it is telling you. And now you do. So take your readings seriously. Track the full pattern. Notice what your body feels like throughout the day. Bring the complete picture to your doctor, because the most dangerous blood sugar is often not the one that looks the scariest. It is the one you misunderstand long enough to ignore.